Yes, we have access to this laboratory test, but the access is very variable. For example, in urban centers, there are available in large hospitals. However, in rural or not specialized settings, these tests are often unavailable. So that causing delays in the diagnosis. Sometimes the industry, pharmaceutical industry, support us with laboratory test studies with a quantitative C1 inhibitor and
Mhm.
functional, and in some cases, the genetic studies.
Well, it's time again to say welcome to All Things Angioedema, the A-Care podcast about angioedema. My name is Thomas Buttgereit, and I welcome you to this new episode. Today, I would like to travel actually to Mexico. Yeah, I have a new guest. His name is Francisco Alberto Contreras Verducho. I hope I pronounced it correctly. And I'm happy to talk to him today about HAE. Francisco, welcome.
Thank you. Thank you, Thomas. Thank you for the invitation. It is truly an honor to be on this podcast, which is so important for medical community interested in
I
angioedema.
think so. I think so too, Francisco. So you're a medical doctor, and I think it's important for the people who are listening to this podcast and do not know you that you introduce yourself. Maybe within 1 minute, tell us a bit about, yeah, in some sentences, what you're doing, what your profession actually is, and what really motivates you to work as a medical doctor.
Yes, yes. Well, I am Francisco Alberto Contreras Verduzco. I'm a pediatrician. Also, a pediatric allergist and clinical immunologist. I currently work at the National Institute of Pediatrics in Mexico City in the allergy service. And also I work together with the laboratory of in primary immunodeficiencies. And now I'm the head of the Institute's Angioedema Clinic.
Great. So I think I'm most interested actually to learn from you how the current situation actually is for treating HAE, hereditary angioedema in Mexico. Can you tell us a bit about this situation?
Well, I think it's the same problem in a lot of countries in Latin America. In Mexico, the HIE remains significantly underdiagnosed. I remember the numbers. We would estimate a probable number of 2,520 patients according our population in Mexico, and about the 851 children, according to these numbers, right? But the reality now is there is a significant underdiagnosis, since only between 14% of the pediatric population are with diagnosis, and about the 21% of the estimated cases have been identified with HIE. So it remains with significantly underdiagnosed in Mexico.
And what is actually the reason for this underdiagnosis? Does it maybe directly have to do with the way and the measures you can use to diagnose HAE, or what is the reason?
I think it's the general physician of all the specialties. They don't know about the hereditary angioedemas. So many physicians are unfamiliar with the condition. So we need to at the primary care level enhancing training, and not only in hereditary angioedema, in rare diseases, and creating maybe simple diagnostic algorithms could make a key for make the diagnosis.
So, do I understand correctly that it is more or less a lack of knowledge and awareness about HAE among the physicians, about the pediatricians and GPs, as you said? So, in other words, do you in Mexico have access to this guideline recommended diagnostic tests, C4, C1 inhibitor function, and levels?
Yes, we have access to this laboratory test, but the access is very variable. For example, in urban centers, there are available in large hospitals. However, in rural or not specialized settings, these tests are often unavailable. So that causing delays in the diagnosis. Sometimes the industry, pharmaceutical industry, support us with laboratory test studies with a quantitative C1 inhibitor and functional, and in some cases, the genetic studies. So it's a good option for us to take the option with the pharmaceutical industry.
But if I understand correctly, you are able actually to have access to C4, also
Yes.
C1 inhibitor levels. But I heard from other countries that they may lack access to C1 inhibitor function. Is this also something you have challenges?
No,
No.
we have the option to make the test, and in the most of the hospital in Mexico, we have a C4, right? And specialized centers, they have C1 inhibitor functional and quantitative, but the most of the times we need to send to private laboratories to make the test.
Mhm.
But this currently is available in Mexico.
Okay, that's fine. So, in the practice you are working, how many patients with HAE, more or less, approximately, you treat?
Well, now it's 12 patients because I'm in the pediatric institution. So we have 12 patients now. I think it's about 24 patients because when
Yeah.
they have 18 years, they change to another institution
Mhm.
to uh, receive the treatment.
Yeah. Yeah.
Yeah.
So from your overview on Mexico, what are actually the treatments that are available? Can you tell us more about this for HAE, specifically for HAE?
In Mexico, I think we are very fortunate because we have the HA treatment to on-demand treatment, short-term prophylaxis treatment, and long-term prophylaxis treatment. C1 inhibitor, plasma derived, also C1 inhibitor, plasma derived, but subcutaneous for long-term prophylaxis,
Okay.
and icatibant
Yeah.
for on-demand treatment, and for long-term prophylaxis, we have lanadelumab.
Yeah. Saberotrastat. Great. So you have actually access, and do you face challenges or certain challenges in prescribing these drugs to patients, to HAE patients? How does this work?
Yeah, I think it because in Mexico the health system is very divided. So there is a social security for workers, general workers. There are social security for state workers and for the oil company workers, national oil company workers, and military social security for military and the private. So it's really a huge a number of the different institutions. So it's difficult to access to the treatment. But in general, the patient have access for general population is the treatment free, and they now the access to treatment for the general population. The most easier to obtain is a C1 inhibitor, plasma derived, and icatibant
Mhm.
is the most easier to obtain. For long-term prophylaxis is more difficult because they need genetic testing, and we need to prove to the directors that the patient needs the treatment for the long-term prophylaxis. because they have the patient have a lot of attacks or laryngeal attacks,
Mhm.
also abdominal attacks, etc. So, but I think it's the most accessible in the public sector is C1 inhibitor plasma derived and icatibant.
Okay.
The others are more difficult, but we have the option to obtain.
So, what are actually the requirements to get these treatments prescribed to patients, HAE patients, I would say, in Mexico? Does it really depend on the disease burden or on the HAE type? So, for example, to say it in other words, is treating a patient with HAE normal C1 inhibitor and a mutation found in genes which have been described to be causative for HAE. Is this off-label treatment or is it included in label to treat these patients?
No, it's off-label treatment because when we don't have the deficiency in C1 inhibitor, or we need a genetic test for proof that the patient has the hereditary angioedema with a normal C1 inhibitor. But in Mexico now is off-label the use of the treatment. So especially for pediatric patients. But we need to use some treatment because we have the no we are not very proud with this first prize in obesity in child in the world. We have the number one in obesity in the world. For example, I have a child with hereditary angioedema with 10 years old and 66 kilograms. So uh, I use the treatment with like an adult, right?
Really heavy.
Yeah.
So, Francisco, if I were a patient actually in Mexico having HAE, what are challenges I would face in your country as a patient?
Well, I think it's the same of the other countries, the delays in the diagnosis and the limited specialized availability and inconsistent access to effective therapy and the social stigma, geographic inequality, and very important economic limitations for all the patients.
And do you have any ideas how to improve the situation for patients, especially also in primary care?
Yeah. We start with the physician networks and support the patient advocacy groups. And now we would to participate in the international registries.
Mhm.
So I think the training programs, national awareness campaigns, that's the work that we do to improve the knowledge about this disease.
That's great. So you mentioned the patient advocacy or patient organizations. Do they already play a prominent role in Mexico, HAE patient organizations?
Yes. The Mexican Hereditary Angioedema Organization is the only organization I think in Mexico. Is a very important organization.
So if you have some wishes for the future to improve the situation in Mexico, what would be, yes, what would opinion?
I think our strategies include expanding the physician education and integrating the HIE into national health policies, creating a national registry. And now Dr. Emmanuel Arce, who was with you and at the recent edition of the Bradykinin School in Berlin, is
Mhm.
launching a national registry for primary immunodeficiency, which will include the HIE. So I think that's a good strategy to improve in the future in HIE care in Mexico.
That's great. So, as you know, we also have an A-Care registry, or which has been initiated by A-Care, the Chronic Angioedema Registry, CARE. You're also invited to join. Every physician who's treating angioedema patients is invited to join this registry.
Thank
It's
you.
specifically made for patients with recurrent angioedema from physicians that have expertise in this field. So you could also think about joining this great worldwide registry.
Of course. And we hope to be in this institute to be the first care center in Mexico in a few months. So,
Great. That sounds good.
yeah, thank you.
That's good. So, as I said, you are really welcome. Have you some last message you want to leave to physicians, yeah, worldwide or from other countries about your Mexican experience in HAE? Something you want to have as final words?
The Mexican experience shows resilience. So despite the systemic barriers, clinicals and patients are working together to improve outcomes. I think the collaboration, education, and advocacy are key. Diagnosis and treatment make
Yeah.
a profound difference. Remember, HIE is manageable, and when we act early to improve the quality of life of our patients.
I totally agree. As you said, I think patients, physicians need to work together to improve the situation of each individual patient having HAE. So it was really interesting for me talking to you
Thank
about
you.
HAE, also about your experience. You shared about the availability of treatments, some shortcomings of diagnosing these patients. And yeah, people who are listening to this podcast, you are really welcome to have and raise some questions if you like. So just let me or let Francisco know if you have any questions. We are happy to answer them. And yeah, I wish you a great day, Francisco. So it's quite early in the morning in Mexico, right?
Yeah, yeah.
While we are recording this episode. And yeah, thank you that I could have you as my guest. Thank you very much.
No, thank you.
Have a
Thank
great
you.
day.
Thank you. Have a great day.
Bye bye.
Bye.